You get a roll call, please?
Councilman Rao,
Present.
Councilman Hunter,
Here.
Mayor Rao,
Present.
Councilman Laverie. Present. Councilman Fitzsimons.
Here.
We're gonna, down on items 4, I'm gonna change up our schedule a little bit there. Item A on 4, we're gonna table for tonight. And I think that's all we need to worry about right now. Okay. Are we in compliance with our open meeting?
Yes.
Public comment. Public comment related to the items on the agenda below in consideration of others who may also wish to provide public comment. Please avoid repetition and limit your comments to no more than 3 minutes. Public comment. Okay, would you come up, please, and so we can.
Microphone, yeah.
I find it very interesting and rather disturbing that requests for funds from the room tax board that are approved by the room tax board are not automatically put on the next city council agenda for approval, because we all know that when it goes to the room tax board, it has to come to the city council. And I just find it disturbing that that doesn't happen on an automatic basis. I just wanted to make that statement.
Thank
Okay.
you. I spoke with Linda about that. She admitted that she meant to inform me that that needed to be on the agenda and I forgot. So I apologize, but we will work on making sure the communication's there. I think as far as automatically having them on the agenda, I wish everything that was said that needed to be on the agenda automatically showed up. But somehow they have to notify me. So as long as that's happening, that would be great, whether that's the room tax board or it comes from anybody taking minutes. We'll make sure that if something needs to be on the agenda, we'll get it on there.
Okay, do we have any other public comment?
4D, the track D.
Speak up so they can hear you.
Track D, B. I'm totally against this. I don't want to see it within the city. I have acquaintances. They can't be friends because of their lifestyle. I went and I talked to them, and even they said that having things like that is just going to encourage the next generation of addicts. Not only that, you stop to think, you want hygiene stuff in there. Where are they gonna do it? They're gonna go into your businesses. They're gonna be going into the bars, using the restrooms to clean up. So just on the fact, for the safety of the kids, I don't think we need it. And like one of them said, if they won't call 911, do you really think they're gonna give somebody Narcan when they're that high?
Do we have any other public comment? Okay,
If this is the time where we're supposed to state our preference for this vending machine, everybody knows it, on the 28th, I'm totally opposed to it. Totally opposed. If they want more information, they can.
I'm here about the 4D as well.
come up close to the mic, please.
I have a loud voice, so. But I want to know exactly the stats on Lincoln County on the HIV, because that's what it's supposed to prevent the spread of HIV. And the other one, I can't think of the other one. I want stats on Lincoln County only. I don't want stats from Vegas, because we're not the size of Vegas, and I don't think we have the drug problem that Vegas does. We do have a drug problem. And I think bringing that in is not going to cure that drug problem. It's not. It's just absolutely not going to do it. And so I think stats for the town would be good. And also, where are they going to dispose of the paraphernalia that they get from these vending machines? And will it be tracked back to that person? Because if you're giving them a needle, how are they going to be for sure know that that needle is going back into somewhere? Because that's when sharing is going to happen. So if we could get some stats would be great.
Would you state your name for the records?
My name's Dawn Mangum. Sorry.
Just a quick comment too. If you haven't signed in and you're going to comment, please put your name down so that we have a record.
Patty?
Thank you.
I'm Patty Long, and I'm also opposed to the 4D
First of all, I'd rather see the sheriff's department take care of the drug problem by arresting them and keeping them in jail or sending them to get treatment. I don't think providing paraphernalia to them or anything like that is going to help anybody. I would rather you do something to help, not to let us have needles, more needles on the walkway, which has been happening. And I also don't understand where the soap and all this has to come. We don't really have a homeless problem. I don't know anybody that's sleeping underneath the bridges. In all of Lincoln County, I don't think that we have a homeless problem. But I'd rather see us go out and help people like what we should do as good Christians instead of providing more ways for people to use drugs. Thank you.
I will sign it also. I just want to say for the same issue, my name is Cole Bratch. I think it's a great idea.
Into the mic.
Yeah, one sec. I'm definitely for the machines. I think Caliente needs to admit we have an issue. And we need to, I know a lot of people don't like to admit that, but I've seen a lot of it as a pastor here. I've seen a lot of it. And I think any step forward you can take, a lot of times we just need to start where we're at, and a lot of people don't want to start where we're at because they don't want to admit where we're at. But we do have a big issue. And I think this is a step in that right direction. And I think it's very important because a lot of people say they want things done, but they don't want to do them. And they don't do them. And I've seen that. And I think we all see the fruit of that in our community. We recently saw a death because of that. And I think any step forward that we can take in that direction, it's not the answer, but it's a step in the right direction. And to do nothing, that's a disservice. Statistically wise around Nevada, I've looked at them, it helps. Even needles, if regardless, like I said, we need to start where we're at. We need to admit where we're at and start where we're at and admit we have a problem and move forward from there. And I think doing nothing is going to cost more lives there. So that's how I feel.
Okay, my name's Cassidy, and I was wondering about like all the dirt bike races we get in town and all the mountain bike races. Here we are, the small community has a vending machine before Ely, so we're gonna tell all these people we have this bad problem. You don't feel comfortable coming in town? I wouldn't feel comfortable coming in town if we had a vending machine. They keep us afloat. If you've ever worked in a restaurant here, you know that's where we get our money in this town. So don't come here. We have a drug problem. We have such a bad drug problem that we need a vending machine.
My name is Roseanne Mangum, and I oppose it completely and totally. And I want to ask you guys right here, how many of you live on a drug street? Please raise your hand.
Don't know.
Yeah, well, you ought to come camp out in my yard sometime. It's pathetic. It's pathetic. And you guys want to put in a vending machine? Okay, what stops that person from giving out their ID so somebody else can get those syringes?
We don't want to put one out. It ain't us that wants to put one out.
I know.
People are here to ask permission.
Yeah, I
Put
know,
one on city
but I'm
property.
here to oppose it. But I would like you people to drive down my street once in a while, once a day, twice a day. I've got it on this end and I've got it on that end. And what comes in is disgusting. And we want to enable them, give them paraphernalia. Why don't you just go out there and give them the drugs? They need to be arrested and they need to go to rehab. And they need to go to rehab more than 1 month or 2 months. They need to go to rehab for a good time so they can get it out of their system.
Have you called Carrie Lee?
Huh?
Have you called Carrie Lee?
Terry?
Carrie, the sheriff, have you called him?
Oh, that's a good one, yeah. They might come the next day. We had a guy try to break into our house because he thought Cody Knott lived there. Well, wrong church, wrong house. That's all I've got to say. I've got a bunch of bullshit on my street. Thank you. Don doesn't want me talking anymore. You're fine.
I'm opposed to it as well. I feel like it would be enabling people. And the thing of it is, the little Narcans that they have, that they're given when they leave jail, even if that person's got the Narcan, do you think a druggie is going to have presence of mind to use it, or if one of their friends has passed out from drugs? I doubt that they would have the presence of mind to use it. And I'm totally against it. Yes, I admit we have a drug problem here. Everybody knows we have a drug problem. But enabling them is not the way.
Ma'am, your name for the record.
Wrote it on already.
Recording, it needs to be recorded, audio.
Just say your name.
State,
Pam Wertz.
Do we have any other public comment?
My name is Eric Bart. How's it going? I also oppose, and I second most of the comments in the back. I believe a machine of such would encourage drug use in the community, and that's not something our kids need to see, for one, and anybody else. It would encourage. Some things would be all right, but needles, stuff like that, no, that's an encouragement for younger kids. It'd encourage drug use. Thank you.
My name's Elissa Evans, and I'm actually a certified addiction and alcohol drug counselor for the state of Nevada. I have worked with the court program for quite a few years in Las Vegas with drug addiction clients. What I have seen and what I've heard tonight kind of shocks me just a little bit, for the reason being that when you are able to get clean needles, you are at a higher or a lower risk of spreading diseases. If my loved one, which I do have a family member that is an addict, is going to be able to get clean needles versus reusing somebody else's, I would want that opportunity to save my loved one, my friends. Okay, so this isn't about giving them paraphernalia. They have paraphernalia, they're shooting up with it, whether it's a dirty needle or a clean needle. I would want my loved ones to be using a clean one, and that's all this company is trying to do. And I feel like it's an amazing thing for the county, for the city, and everything. I think there is a bigger problem with the drugs here, and we do have to acknowledge that there is drug use here. We are not giving them, or the organization would not be giving them drugs. That goes through a whole different program. This is about keeping our loved ones safe from getting other diseases and illnesses through a needle. Like, there needs to be more therapy in this community and different resources on that matter. And you know what? That's what I hope to bring in the next year or two, because I am actually in a master's program for social work to be a clinical therapist. And I hope to one day be servicing your family and your friends here, because this is where my heart is. And so with that, I am for the Track B Exchange program in our community to help our loved ones and our friends that struggle with this horrible disease of addiction. But you know what? I also hope that they get treatment and that the resources are coming to this town and this community, because that's what we need to see. Thank you.
Do we have any other public comment? Okay. We will move on to the consent agenda.
Move for approval of the consent agenda.
I'll second that motion.
Okay, we have a motion and a second to approve the consent agenda. All those in favor?
Aye.
Aye.
Motion carries. Okay. Items for discussion, possible action. Approve or deny Lincoln County High School Student Council's request for permission to host their annual homecoming bonfire at the Industrial Park on Thursday, October 14th. Do we have some representatives here?
Come on up, ladies. Make sure you speak into the microphone. Tell us who
First
you
of
are.
all, I'm Eliza Pike. I'm the current LCHS Student Body President.
I'm Katie Davis, I'm the Vice President.
And we have a safety, I don't know.
Plan?
Plan, yes. I'll look at it.
Just so council's aware, they have also submitted a request to the volunteer fire department, which was approved at the last meeting 2 weeks ago, and even last night, that the local volunteer fire department will have a truck or two on standby out at the industrial park for the homecoming bonfire, as usual.
So yeah, when this was written, we didn't have approval yet, but now we do. So yeah, so it says we're in the process, but we have that now.
So yeah, this just lays out everything that we are proposing. It has the name, the description, everything. We just wanted to have the annual bonfire, and we're just here to seek approval. So we have the, just in case, we have the fire department that's going to be there. And just in case anything gets super out of hand, we are gonna be able to call 911 and have an ambulance come out and get to the hospital very quickly, since it's just a few blocks away. And then for the perimeter guidelines, we're gonna have the students up on the berm as usual while the fire's being lit to avoid any accidents. And we're gonna, like after the fire is lit, we're gonna have them come down, and the berm will be there to keep them from getting too close to the fire.
And then for the traffic control, we'll have all the students ride down on the Caliente, on the bus to Caliente. So no cars will be out there. If there are vehicles, it would be for staff and obviously the fire truck.
And what time is this and what date?
It is October 14th, so this coming Thursday, and it's from 8 to 10:30 p.m.
Any questions?
Have any questions for these girls?
Well, I think they've done their homework, and for once.
Thank you.
And I make a motion to approve the Lincoln County High School Student Council's request for permission to host the annual homecoming bonfire at the industrial park next Thursday, October 14th.
I'll second the motion to have the bonfire at the industrial park.
Okay, it's been moved and seconded to approve the high school's request for the bonfire at the industrial park. All those in favor?
Aye.
Motion carries. Thank you.
Thank you.
Thank you.
Approve or deny Angela Hansen's request for a donation of $500 to help cover cost of the, Laney Wilson concert held at, Bobby's Barn and Venue on September 29th.
If we approve this, it would be the first time that this organization has ever approved something for a private business. Have never done that before. Just want everybody to realize that. We've never done that before for a private business. Saying that, I would make a motion that it's not approved.
Oh, no, I was gonna talk. We still have discussion, or do we still need to?
We need to wait. We need to wait for the motion to die for a lack of second, and then you can discuss it. So we can wait a couple seconds for a second. If not, then it dies for lack of second, then we can go back to discussion.
Okay, we have a motion. Do we have a second? If not,
Motion dies for a lack of
it
second.
dies. Okay,
I too had some questions. I talked to the city clerk earlier. I understand the agenda, the mix-up. I found that out as well. She does have the request here. It was in our packet, and yeah, that isn't cheap. $8,000 for this event, and she was looking for the $500 donation. And I do agree with Councilman Rao. I mean, I know room tax already approved it, and we don't have to approve it as well. But to me, that seems like, I mean, I didn't go to this concert, but I'm hearing it's $50 per person to get in there. Like, where are the facts on how many people attended? What kind of money was generated? Is there an itemized list of why she needs the $500? And in keeping with room tax funds, again, like Councilman Rouse said, we've never done that for a private property or private residence. So my question is, on this is, did this really bring a lot of people to town? Like, it seemed like a lot of locals enjoy it, and she did say she advertised it everywhere, but for that reason, I agree with Councilman Rao, and I won't make a motion yet because, for further discussion, but I had several questions when that came across as well.
I wasn't able to attend that meeting, and that's the board I'm over, but I would have had the same questions as Councilman Rao and Councilman Simons on making that donation where it's private and private venue. I do think it's good for the public and or for our town, and hopefully she keeps doing it, but yeah, I don't know if that's the best way to go about it.
I was at the concert. It was a great concert. I think it was a very good, and there were quite a few people that were not from, that I did not recognize from the local area. I do know some people that travel from St. George. I talked to them. Can't remember their names, to be there. And it's not out of the ordinary for a public entity to provide and give these kind of things. I mean, you see the city of St. George brings in these kind of events and pays and supports those kind of things and brings those in. I think that it also goes a long way to, as you see Lainey Wilson during the show, she pointed to Angela and said, I love being here. I want you guys to schedule me to come back. This is a big thing. That week, she was the #1 country song in the country. Happened to be that same week that she attended here. She makes good comments, and so I think that we need to think outside the box of ways. We're trying to look at ways to bring people to the city of Caliente, and I don't know all the statistics and the facts. I don't know how many people came from out of the area, but I do kind of look at it and say that we asked the room tax board, who they're the generators of that tax, we asked them for their input to spend that money. And we got to take some weight when they've approved to spend that. They're the generators. They made that money with their businesses, and they see it as a good use. Puts a lot of weight to me that we need to look at that and realize that they put the thought into it, and they're the ones that benefit from it. And so I think that we need to really consider that. And I think that it's a good event, even though it is a private moneymaker for a private individual. You can look at the races, Best in the Desert. They make money off of it. All those people, they make those. All these other events, they bring money in to private individuals. And so the point of it is we need to bring events in to bring money to the businesses. And I think this did accomplish that. And the guy who owns the barn and Angela, they're all local people. They're business owners. They own businesses, and this brought business into them. So I'm more inclined to think it's a good thing, and we ought to put some weight in that.
I agree with Jamin on some of that, but I'd like to see in the future that comes, and again, I'm torn because I wasn't at the meeting that I should have been at anyways, but I'd like to see them come before, like Best in the Desert, or most organizations do, they come beforehand, have it planned out, have it thought out, see, like Sean said, some numbers, some statistics of what they might bring in. That's kind of where I'm torn a little bit, is after the fact of.
I agree completely. I think
There may be a reason why they need to, I look at it more like maybe she's trying to recoup the advertising dollars, and I do know there was a lot of advertisement that went out for it. So, but in the future, that's what I'd like to see. Beforehand.
Was it a Thursday night? Wasn't it a Thursday night? It was okay, worse. It was a Wednesday night, and did people stay in the hotels here in town? They drove right back to St. George right after it was over. I mean, I don't know. That's the only time she could probably get on her schedule is a Wednesday. It's probably not their fault as far as the promoters or the business owners. But like I said, it just, kind of a dangerous precedence, I think. I mean, because then somebody privately can just seek that. But that's up to the room tax as well. Like Jamin said, Councilman Hunter said that. It's their prerogative. They're the generators of it as well. So that's all I have.
I think it's a great idea, then couldn't we just say that, that the money should not just be handed over to blank check, maybe slated for certain.
You have to speak into the microphone.
Well, first, she has to be recognized by,
No. Yeah, we're discussing that up here right now, so
Oh, so you don't want?
no, we
Yeah,
were
no,
not
okay.
asking for public comment right
Okay,
now.
okay.
I make a motion that we approve the room tax board request for Angela Hansen and follow there.
We have a motion to approve. Do we have a second? Motion dies. Any more discussion?
I'd move we disapprove it.
I'll second the motion to disapprove.
Okay, I have a motion and a second to disapprove the request. All those in favor?
Aye.
Motion carries.
if you just ask for an opposition vote.
Yep.
And I oppose.
Okay. Okay, item D, approve or deny track B harm reduction measures, including possible placement of a harm reduction vending machine. We. Yeah, right there.
Good evening, everyone.
Good evening.
Hello. Oh, other side.
I just want to make sure that shows up here.
Does that work okay?
Good evening, everyone. My name is Chelsea Cheatham. I'm here from Track B Exchange with Christina Pereira and then also Jessica Johnson from the Southern Nevada Health District. So we're just going to do a quick overview of what we're talking about tonight, which is Track B services, all the services that we offer in general, our work currently that we're doing in Lincoln County. We're going to talk a little bit about the public health vending, and then we're going to go over the results of the town hall that we had a week ago. All right, so Track B is based in Las Vegas, but we also have offices in Elko and Winnemucca currently. And we also have peer recovery support specialists, so people with lived experience who are in recovery that work for us. And they are all located in Hawthorne, Ely, Elko, and Winnemucca. Track B began in Las Vegas, but we've brought our services to several communities throughout the state of Nevada. Some of the services that we offer are syringe exchange. So we have a storefront program in Las Vegas, as well as we do syringe exchange in Elko, Nevada. We do naloxone distribution, and that's throughout the entire state. We do that in person. We have a mobile unit as well as shipping directly to people. And then we also offer that through our harm reduction vending machines. The vending machines are located in 8 locations currently. We have 7 in Las Vegas, 1 that's located in Hawthorne, Nevada, and we have approval for a machine that isn't going to be placed in Ely, Nevada. We do medication-assisted treatment, so people who have opioid use disorder, we are able to provide them with medication to help them to transition from opioids. And then we also have a 24/7 warm line that we have available for people to call 24 hours a day, anytime they want to get into treatment. And that's offered for everyone in the state. And then we have peer recovery support services, where people with lived experience are able to share their experience with people that are still currently using substances. So we wanted to talk a little bit about our program support and our financials. So the purple and blue sections are from our state opioid response dollars, which is where the funding for this program comes from. The first part is to address services in the rural areas of Nevada, and then we have another second part of those dollars that is for emergency department response, and we work in UMC Hospital in Las Vegas, as well as Renown Hospital in Reno. We get about 3% of our finances from donations, and that is due to the fact that we cannot purchase syringes with federal dollars, and that's just across the board. So we have our executive director, Rick Reich, is one of our biggest donors, and then we also have mutual aid from participants in our program who want to help support the program. So a little bit about our work in Lincoln County. So Christina and I travel here every 2 weeks, and we offer peer support in Lincoln County Jail. And we also offer counseling and assessments for people that are looking to get into treatment. We provide transportation for people directly from jail to treatment or from the community into treatment if that's what they want. So our assessments help to get the person in the door to a recovery center. We offer medication-assisted treatment to people that are looking for that, and then other resources to help people re-enter the community.
I'm Jessica. I'm going to talk specifically about the public health vending machine project. So Chelsea mentioned there are currently 8 machines in the state of Nevada. Nevada leads the way nationally on the vending machine project. So we're the first state in the United States to implement these. Illinois and Ohio have since implemented these. The contents vary by community needs. So communities can do a needs assessment to determine which products they might want to have in the vending machine. We listed other products in here that the machines contain in the other 8 machines, which include syringes, as discussed in public comment tonight, naloxone, fentanyl test strips, hygiene kits, so if you needed to take a shower or something like that, shampoo, toothpaste, etc., safer sex kits, first aid kits to treat minor wounds and wound care, and pregnancy tests. Additionally, each machine has large sharps containers next to it for disposal, so that would be available to anyone in the public. I did hear some folks mention this evening that sharps were a concern for them, that maybe they had seen that in the community, and this is a location where those sharps could be disposed of. In order to access these machines, it's not like a traditional soda vending machine where you put in a coin and get something out. There is a sign-up process. A valid ID is needed in order to get a number to access them, and that allows the product to be dispensed on a limited basis. So we can set the limits based on community need for how much one person could access. This is a sort of sliced off photo of one of our vending machines in Las Vegas, and you can kind of see the syringe, sharps container, next to it. I wanted to highlight some of the benefits. So on the left, these are from CDC evidence-based benefits on harm reduction programs. And on the right are some of the data from TRACK-B Exchange themselves. So syringe exchange programs, as evidenced by research, have reduced the number of syringes in the community and reduced needle stick injuries, predominantly from law enforcement, if they're doing a stop and frisk for somebody, that it helps to reduce needle stick injuries. TRACK-B disposed of 498,188 syringes in the year of 2020. Access to naloxone reduces number of overdose deaths. I received a report on our drive up here that in 2020, Nevada, the state of Nevada, had 788 overdoses. That's up 55% from 2019. So I share that with you because it came into my inbox on the way here, and just how important this ever-changing drug problem is. 228 overdoses were reversed with Narcan handed out by TRACK-B staff between September of 2020 and September of 2021. We know that there were more. Those were the ones reported back to the agency. Fentanyl test strips have been demonstrated as a key tool for overdose prevention, for someone to change their behavior or their habit based on knowing what's in the substance. In 1 year, there were 79 strips that were returned to TRACK-B Exchange, and 71% of those were positive for fentanyl. That's not unlike what we're seeing in our drug seizure data or in my job at the health department, where we look at deaths and non-fatal overdoses. Here's just some brief data from the vending machines of the lifetime of use. So this looks at syringes, naloxone dispensed, pregnancy test kits, and safer sex kits. We recognize these are from all 8 machines. And as I mentioned before, Nevada leads the way nationally in this program, so we would love to showcase other rural areas and what they're doing with public health vending. It just doesn't exist yet. This is a very novel program for the United States. Internationally, it's been well established, but it's novel in the US. Christina?
Hi, I'm Christina, and first I just want to thank everyone that came to the community forum that we had last week. I see some faces here in the audience, so thank you for them. That was on September 28th. We advertised this on the Sheriff's Office Facebook page, the Lincoln County Record, and flyers throughout the community. Approximately 50 community members showed up, attended, and learned about our services. Just wanted to show this was the flyer here that we had used to advertise, so you could get a look at what was going around your community. And thank you to everybody that helped put those flyers around. So we handed out a community needs assessment just to see what the community wants, right? That's the best way to find out, is just to ask. So I wanted to highlight the results here. Over 90% believe that substance abuse is a problem in the community and are interested in our peer services, a warm line, hospital response program, and medication-assisted treatment. 84% are interested in having a vending machine in the community. And what else would you need to know for us to move forward? Oh, sure. So 84% of those that filled out the community needs assessment were interested in having a vending machine in the community.
Do you know how many of those questionnaires you handed out?
23.
23.
We handed out
To
about
everybody,
50.
and you received back 23.
Yes, and we received 23, correct.
So out of 23 people, you got 84%.
Yes.
Needs to be more people.
And we're open for questions.
Well, I'll speak here a little bit. Since this meeting, I was at the forum and listened to everything that was going on, and since that time, I've talked to just about everybody. I've gone to the stores, and I've talked to the clerks, and I've talked to people in the stores. I went to the fire station last night and talked to people in the fire station. I don't know how many people I've talked to, probably 60 people. There has not been one in favor of having this machine. They're in favor of a lot of the process, and a lot of what I'm hearing right now is we have AA, we have DA. Why can't these people assist you guys with that stuff, and rather than have this thing put out in the public here, and where we have most of our income for these businesses and stuff in town are gonna be from outside of town. When people comes in, we set a thing up and they see these machines, there's questions asked, you know? And why can't we work with the programs that we have now? And that's what I'm getting back from these people.
Is that a question we can respond to, sir?
Yep.
Perfect. One, I would say that this is just one service in a suite of services that we know are important. You do work, TruckBee does work
with other agencies in town and other people, in order to help link people to treatment.
So AA and NA and those groups are absolutely a part of it. Prevention is a part of it, harm reduction, treatment, recovery. We know that all of those services are desperately needed in all communities, right? As we see substance overdose increase. The second thing is that I don't believe a location has been determined yet, and so I think one of our questions tonight is what else would you need to know to move forward? If that is, it sounds like location is a primary concern. I don't believe one has been determined yet, and so we wanted to share that. And I did hear a lot of questions about product, and product could be determined too based on the needs of the community. Thank you for that.
I got a question and a comment. So I'm honest, so I'm the son of a drug addict, and I don't see any good in this at all. And two, if you want a location, take it up to Sheriff Lee's jail and put it right there, and he can see who's getting the stuff out. And you said, and one other thing, and you say you give rides to people. I come from Pioche. Most people I see get out of jail are walking from the jail and hiking right down the road. So I don't know. I'm sure you give a few people rides, but
So people
anyway, I wasn't done yet, but yeah, take it to the jail and put it there. We don't want it right in our town. You're just enabling people. My comment, and I have firsthand 15, more than that, 20-something years experience with drugs, drug addict.
So it's real for you. You definitely know how it is.
Of my opinion on it.
Location, getting back to that, your map on your website had listed Hawthorne, Winnemucca, Elko, Ely, obviously your Las Vegas locations. But then verbally you said tonight, Ely is not, it's not happening, right? Like,
We haven't found a location in.
okay, so I spoke with Desiree Robinson, she's over Public Health in Ely. So again, same thing in Ely, no location. Could you tell me where the location is of your vending machine in Winnemucca and Hawthorne?
So the machine that's in Hawthorne is actually located outside of the, one of the city buildings.
Yeah, of the city building inspector.
Yes.
No, the Public Works building. It's an outdoor location in Hawthorne, and there's no
There's no
vending
machine
machine
in
in
Winnemucca.
Winnemucca.
There's not one yet, okay. Because I talked to Mayor Stone today in Winnemucca, and he said that the same issue as far as opposition and as far as finding a location and I do appreciate you guys. I mean, you're passionate about your job, and I love that, and not picking a fight. But you look at some of your locations in Las Vegas, and I will not mention the names of, but some people are familiar with Las Vegas. 1830 East Sahara Avenue, 401 South Maryland Parkway, 3050 East Desert Inn Road, Cheyenne Avenue, West Owens Avenue, North Nellis Boulevard. We understand that, but as mentioned in public comment too, it's just, these are not, it's not Las Vegas. And also from your website, it says all machines can carry syringes, other products may vary by site, which is totally understandable. So we're not even at a place where we could pick and choose and say, yes, bring it in, but don't put syringes in it. Is that correct?
No, you can. It's up to the community.
Okay.
We would encourage communities to, as I mentioned, do a needs assessment with folks who might use the machine in order to determine what products might be best for the community.
Okay, yeah. And I was just asking questions, so, okay,
Oh,
thank you.
Totally appreciate
All right.
it. Definitely open to questions.
Yeah, we usually don't have a big crowd like this to our meetings. These are the people that put us up here. And when they speak, we should listen. First thing, if the location was around City Hall here, that's a complete no-no. We've got over a $2 million construction job that's going on here in the next few months. It's gonna last for several years until we get this whole building completely restored. And we've got to listen to the people here.
And I'm going to take my time to make my comments, and I'm apparently not the very popular one tonight because I've got a few different opinions of things. And I look at, I think that a lot of people are quick to judge. I think if you look at the program, I've researched a little bit, not a ton on it, but I think that we do need to admit that there's a problem in the city of Cowley, and we need to accept people that are willing to come and help.
I gotta interrupt you real quick, Jamin, and I don't mean to be ignorant, but you don't, you don't, oh, we gotta admit we got a problem. It ain't, I could walk out and go down the street right now and I can find you 10 people that, I mean, everyone knows there's a problem here. You don't gotta be a damn fool to even know that. There's been a problem here.
I think that there's a lot of useful products, and I think people need to realize that this is a resource that's willing to give us what we want. They're not forcing anything down our throats. They're only gonna offer us what we ask for. They don't wanna force anything to us. And having Narcan available is something that's beneficial. I think that having the endorsement of, I understand that the sheriff is in favor of this program. Having one of our pastors that points out he sees a benefit in it. I think we need to not rush to judgment and say, we don't want anything you guys have to offer. I think we need to look at and pick what services we would like them to offer for us. It looks like they're doing a great job at the jails and doing some things. They're giving somebody a ride. I don't know who those people are. I'm sure there's a lot of people that don't want their ride. And they've judged and said, we don't want your services. We don't want your help. And I think that anything we can do to help an addict, we need to look at that. And whatever these people can offer, I think we need to consider that and not just rush to judgment on it. Might not be a popular opinion, but that's the way I see it. Let's be fair with these people and take the services that they can offer, because it's been said so many times, if you can help one person, what's it really worth?
And the program, I mean, it kind of meets users where they're at, right? I mean, that's probably your bottom line, which is fine. And you answered some of the questions already that the public had, as far as they'd have a PIN number and they'd access it and you'd have a way to track it, right? As far as that's concerned. But at the same time, you know, obviously, I think this was in the works long before. It's been in the works for a while. And we did have a tragedy here not too long ago. And I think that's part of the issue at heart here is the tragedy happened and it kind of magnified it a lot, brought a lot of things to the surface. And again, appreciate your passion and what you're doing. But to me, it's more than just location in my mind. It's something that I can't, I mean, I think it's a good start, but I don't know if the vending machine's a good start, to echo some from others tonight, so.
I just want to read back to this. I appreciate your passion also, but I'm telling you what, unless people want the help, you can't help them. And I haven't seen any of them coming and going, oh, can you give me a clean needle? I'm sorry, but and yes, we all know there's a drug problem in Lincoln County, not just the city of Caliente, but in the whole county. And I still think you need to go to treatment, and the sheriff's department needs to arrest and not let everybody out so they can snitch on somebody else. And it's nice pastor thinks it's all good, but bring them into your church and start saving them that way. I don't think you need a vending machine. I don't know if you do or not. But I don't think you need a vending machine for them to save anybody, because that's not going to do it. It's not going to.
Would it be all right? Oh, sorry. Sorry, late. I was kind of helping, talking to people about treatment. I'm Michelle. I'm a licensed alcohol and drug counselor that works with TRACB. We're never pushing or pressuring anyone to do anything they don't want to do. Yes, we can't help people if we don't want to change, right? Everyone knows that. You have to want to change. But there's also stigma involved with mental health, with substance use. So if I'm using syringes, I'm probably not going to go up to someone and say, hey, I'm in desperate need of clean syringes, because most likely people aren't going to want to help me. They're going to maybe shame me. I'm probably embarrassed about it. So having a vending machine that has that supplies is a way to kind of offset and help people. Letting them have access to something like that.
How did you find us?
You said we have facilities here in the town.
How'd you find us?
I came in with them, so I was upstairs in the shop.
No, I'm saying, how, did you originally find us?
Who invited you?
Where's the
Haley Glockner.
legal, man? He's gonna keep this off the rails.
Haley Glockner, and when I was brand new hired as a new community health worker under Nye Communities, based out of Lincoln, going from my past experience, I went around the community, reintroducing myself and my new career. I was fortunate to meet Chelsea up at the courthouse, and it was actually our local judge. Which one, please remind me? Dabreski? He wanted them in this county. I went in just to introduce myself as a community health worker, and he said, I want you working with her. Would you help introduce her? Because you guys know me. My career has had me all over the county. That's how they came in, under the judge. The judge wanted them here. Also working in connection with Sheriff Lee. So they were invited in. They didn't just plop in, Thank you.
Susan Devery, you said we have facilities already available to provide services here. So maybe in the interim, if we're not going to do that yet, where like the health nurse, Is there something at the hospital? Do we have some of these services available already? I don't know about the needle thing, but, first aid kits, health kits.
Is there narc
Then we just need to, educate us in the community to know where those places are.
I got a question.
Name is Jack Warner, for the record, 640 Dixon Street, Caliente, Nevada. I was a patrolman in Las Vegas for 5 years. Went through the academy, learned about drugs. Since then, I've been a fireman, paramedic in Utah for 26 years. I put Narcan on a lot of patients. Some I saved, some I didn't. My question here for the forum is, are we encouraging or discouraging the use of drugs? It sounds like we're saying it's okay to use them, just come over here and give me your needles, we'll do things. My comment. Thank you.
I've got a question for you ladies. Is a hypodermic needle considered drug paraphernalia?
It's not.
No.
In 2013, Senate Bill 410 was passed in the, sorry, I can take this off to speak, I apologize. Senate Bill 410 was passed in the Nevada legislature, which expressly excludes syringes as paraphernalia. Additionally, in 2021, Assembly Bill 345 excluded fentanyl testing strips as drug paraphernalia and clarified that items used in with syringes to prevent HIV and hepatitis C were expressly not paraphernalia under Nevada law. I'm not a lawyer, but that's
Thank you.
that's my reading of the law. Great
Thank you.
question.
I have a question or a response to that. If you all will look up, Eve Whittle, if you all will look up the Department of Justice description, you can look up any dictionary description, you can look up Republican state legislature descriptions. Yes, it is definitely drug paraphernalia. We have a very liberal governor, Senate, and Assembly who has helped destroy Nevada. So that's why it was taken out of the language in the NRS statutes.
I have a question. Why can't we just work with you guys and not argue and just not have a vending machine? Like, we have Haley to hand that out. We have Nicole in Panaca, the public health nurse that hands out condoms. She has since I was a teenager. We have other resources, and then work with you guys and all get along and like have you guys help us, still help us in the jail, and not have a vending machine. Like, it's such a big problem going back and forth with this vending machine. We have Haley here. We have a public health nurse here that's been here since I was a teenager that hands out condoms. They can hand out the health things. Like, why do we have to have this vending machine? We have, you know, we have like we have people, like we have a elementary that if someone, okay, I have drug addicts in my family that have told me personally that they go to the pharmacy and get needles. If we need needles, they can go to the pharmacy and get them. Why do we have to have it? I know drug addicts are in the community that go to that pharmacy. Why are we fighting? Why don't we just put it in Haley's office and they go get it?
We're letting the people get attacked. So I think we need to
No,
move on.
I'm not attacking you. I want you guys here. Like, why don't we just stop fighting them? Like, everybody's attacking you guys. Like, why don't we just stop fighting about these babies? What we already have.
Sorry, ladies.
Hello, gentlemen. I'll just, my name is Albert Bass. I am the Lincoln County Liaison with the Nye Communities Coalition out of Nye County. I work in the rural communities all over this state. For 7 years, I've traveled the country in conferences, going to drug conferences, working with the DEA, working with local counties, working with the FBI, HIDA, the High Intensity Drug Trafficking Association, just studying and researching due to my family's issues on drug addiction. I spent 15 years working with the Nye County Sheriff's Office. I've just recently joined working with Sheriff Lee out here. I spent 8 years as a firefighter. And Narcan is not just for addicts. It could be anybody in your family who is prescribed an opioid and misuses that opioid, and you don't know what it's going to do to them. The other thing is some of the drugs that children are getting on the street are laced with fentanyl, and they have no idea. And we know from statistics just in the state of Nevada, 1 out of every 5 teens takes drugs from their home and uses it and shares it with their friends. And they don't, and many of those are opioids. So Narcan is just to save lives. Bottom line, that's it. Now, I wanted to share with you also just something really quick. This is your community. I'm not here to tell you what to do with this. This is your community. But the Nye Communities Coalition and myself and the staff that we have, we'll have, 3 ladies working in your community that live here, is to help support what you want. So whatever it is you decide to do, we are trying to bring you education, awareness, and resources to your area, because I live in rural communities and I travel and work in all the rural communities of the state. I know how hard it is to get those. So we have committed ourselves to come and help you with what your needs are and what you decide to do and with what your community wants. But I can tell you, we're in a new era of drug use. We have a 350% increase in drugs coming across our southern border. We're in a new era, and you cannot arrest our way out of this problem. Across the nation, communities are using deflection and diversion programs to try to attack the addiction problems, because we just can't arrest our way out of it. It's part of the process with the justice system, but we're trying to implement other and new things to create that awareness, create that education to help save communities and save lives, bottom line. So what you choose to do with this, of course, is your community's decision, as George over there said, as it is in every community, because I work in all of them in the state. But I just want to let you know that we are here to help through the Nye Communities Coalition with Haley and the other ladies that we have employed to help you with what you do want and to help you get the resources you don't have. So I hope you'll keep that in consideration moving forward to help you with the problems that, listening to your community, I didn't realize were that big in your community. So if they are, we want to make sure we can help you with those. But that's it, gentlemen. Thank you for your time.
And so the council knows, and the gallery, Mr. Bass and Mrs. Glockner have done a great job with the naloxone training. They've did about a month ago with the high school teachers, had a training. I know that Mrs. Glockner talked about other avenues to have those trainings in local community centers or fire department, that kind of stuff. So I have seen Mr. Bass and Mrs. Glockner firsthand doing that part on the naloxone training. So thank you for that.
And Mr. Bradshaw, before you begin, and I don't mean to single you out, it's just the meeting's getting a little out of hand. So before you come up, please, Mayor Rao has to recognize you before you can make a comment.
Yeah.
But, so it sounds like Mr. Bradshaw has something to say, and if Mayor Rao is going to recognize him, he can go forward.
I think we've been getting on things here. If you have just a comment to make, let's make that. Let's not get into a question.
No, it's just a comment. I just want to say, me personally, I don't want the needles. And I think it's something that if in time it became a big issue, then like Sheriff Lee said last week, if in 10 years it's an issue and we're finding needles all around our parks. I used to live in Utah and there were needles everywhere and they couldn't control the problem. But if it ever does, then you can put those in and you can assess that you have the option. But the thing is, even if it's a machine with Narcan, that's it. And it can save one life in our community because someone goes and gets it and just so happens to have it in their pocket. Believe me, if it was your child, you would hope that someone had Narcan in them. If it's a fentanyl strip and that person, I know a lot of people, if you could test that and see if there's fentanyl in that, I mean, we could have 2 items in that machine. We could have, you say there's no homeless problem here. Why not give soap or shampoo to the one homeless person there might be here? Because, yeah, we don't have a big problem here. But look, if you can help one person, and what's the big deal if someone gets someone else Narcan? It's not like you're giving them alcohol. It's like, oh, I'll use my ID to get them Narcan. They're whoop-de-doo. It's not a big deal. You're getting them something that's going to save their life. So if we choose 3 options, soap, I've never seen soap kill anybody. I've never seen soap cause an issue. Have you guys? I've never seen Narcan hurt anybody. It can't. If you take it, it actually saves life. And can you imagine if someone just so happens to take their fentanyl strip and put it on something and says, you know what? This is laced with fentanyl. I'm not going to take this. And they live long enough to get them into our churches. We do bring them into our churches, just so you know. Bring them into our churches. Bring them into the community. This whole point of this is to keep them alive until we can help them. They have a warm line. They can call for help if it just helps one person. Forget the condoms. I'm not for condoms. Forget the shots. I'm not for shots, but let's look at what maybe, even if it's a machine with Narcan, that's it. If it saves a life, and if it was one of your children, and any of your children, and someone else was there and gave it to them, and they lived because of that, you'd change your mind.
I just have one quick comment on this, just real quick. Once you get your foot in the door, it's over.
I got a comment too.
All right, one last comment.
The gentleman that spoke just a few minutes ago, right, you mentioned that the opioids might be in any family. It's not going to be any family or every family that has this ID card. We all know where we can get help. The clinic, the hospital, every police officer, every ambulance carries the same stuff in their everyday materials.
Why are the doctors at these meetings then? And I've got it right here.
Okay. You guys have anything else?
I just wanted to thank you for your time tonight and consideration. We even may request, if you choose not to take action tonight or have other information that would be valuable to, that you would like to know, we would be happy to gather that and come back if invited for an additional presentation.
Thank you, thank you.
Is there anything else? Sorry.
Franklin, I want to make a motion, but I got a question first, because reading this, approve, deny, track B, harm reduction measures, including possible placement of the vending machine. Should we table that, like, for the, for the further discussion of the
Sorry.
track B harm reduction measures? I mean, I'm against a vending machine.
So
I'm sure there's a lot of people are.
You want to tease out what harm reduction, additional harm reduction measures?
Yeah, because, I mean, again, I'm not against, like, I think someone mentioned it, the assistance from
Yeah.
track B, it's the vending machine part.
Things you can do, I mean, if you're flat out against the vending machines, you could make a motion to deny the vending machines, but continue to discuss possible future harm reduction measures that do not include the vending machine. That's the way to do it. Or you could just table the whole item. There's multiple ways to do that.
Well, and a question for you ladies is, do you have programs in place where you have hygiene kits that you leave with public health nurses and public health?
No.
You do not? Okay,
No, they're given out through the vending machine.
okay.
Can I say something on that? RSVP and the Methodist Church have hygiene products free. Are we asking?
I'm
Yeah,
sure,
I'm more,
I'm sure
I'm
there's
more
other
in tune,
resources.
I'm more in tune with the counseling and things like that, not the, I'll give a guy soap, that ain't a big deal.
Okay, we have any other questions for these ladies? Thank you.
Thank you for your time. Thank you.
Thank you.
Make a motion, you were just saying that.
So I'll make a motion to deny the vending machine and approve future discussions with the track B harm reduction services.
On city property, right?
I mean, I guess technically you can't prevent them from putting it on private property.
Right.
But yeah.
Private property or county property, you're talking about city property, right?
Yeah, city property.
But to continue discussions of harm reduction programs.
Yeah.
Measures. Okay.
I'm gonna need some help.
All right, so we'll try to repeat it. I can
clarify.
repeat it.
Real slow.
All right, so I'll make a motion that we deny the vending machines and approve future discussions with track B harm reduction measures and other options moving forward.
I'll second it.
Okay, we have a motion and a second to deny the vending machine, but to move forward with helping with the track B harm, what is it called? Harm reduction measures. All those in favor?
Aye.
Motion carries. Okay, we got one more there. Approve or deny city's purchase of 3 40-yard roll-off trash bins and steel to install push rails on the bins.
Just a quick note before, there's a little bit more information on the second page. I don't know if you noticed that underneath the approve or deny. So that, just to answer any questions that maybe weren't caught there.
Guess I don't have the current agenda. I'm not seeing it on there, but I'm glad it is.
Okay, yeah, here. The one,
I'm looking at it on my computer, so let me see what you got. I've got the quote from Waste Quip on the bins. Gotcha.
That's on the back page.
don't read my notes.
I'm just looking at the one I had earlier that I didn't look at the updated one, I guess. So, earlier this year, I spoke with Corey Lytle, who runs, not Corey, I apologize. I spoke with Ivan Jones, who is the manager for Lincoln County Solid Waste. And he explained to me that each year we're supposed to look at our contract and decide what needs to happen, if they need to raise the price on us, do things like that. And he told me that if we could buy some roll-off dumpsters, they would not need to increase the rate that they charge us for hauling the trash and taking the waste at the landfill. So I got this bid from Waste Quip, and they have, from the looking I did, they have the best bins because we are pretty rough on them as far as the way we have trash dumped in and then we compress it with the backhoe to have it hauled off. They have the stronger bins that are made for that, short of getting a rock bin, and the rock bins were much more expensive, so I didn't look at that. To get 3 bins would be $34,991, and then we would need about $3,500 worth of steel to build rails on the bottom so we can push them into place in our transfer station in the hole there with the backhoe. Because we can't just pull them out and set them right in place where we need them to go. We have to have them set in the middle and push them over against the wall with the backhoe. So, and what I was looking for was to be able to use, I believe it's Recovery Act money for that.
Yeah, the ARP funds.
Is it ARP, American Recovery? Yeah.
I think it's pretty straightforward. I think it's pretty clear, and I think it's a good deal that the county's willing to work with us on it, so. Any discussion on it?
How long would it be until if we approved it, when can we see them? I mean,
You
as far as
know,
delivery and,
That I didn't get into Mrs. Garcia with, but she's got the shipping there for the 3 bins. It didn't sound like it was going to be a long time, but I didn't actually ask that question. I apologize.
Where they shipped from? Where they made at? Where they shipped from?
I'm talking to a lady in Arizona is the salesman, but I believe they're made in northern Utah.
I make a motion that we approve the purchase of 3 roll-off containers through the ARP funds.
I'll second the motion, being that it is the ARP funds and not taking anything off of our the general fund or budget, correct? So I second the motion.
Okay, it's been moved and seconded to, okay, the purchase of 3 roll-off bins, the price of $34,991, and the steel to reinforce them for $3,500. All those in favor?
Aye.
Motion carries. Update concerning ongoing grants administration, CDBG depot grant.
Outside of what we reported last, I don't have anything to add. We're still in the process with Heritage and that ongoing discussion.
Well, that meeting last Friday was pretty productive, I thought, with her.
Yeah.
Yeah, I thought that was good, the Zoom one we attended, so. They told everything that, yeah.
That meeting was in this last couple weeks, so.
Just jogging your memory.
Thank you. Other than that, I don't have anything else.
Okay, any questions for our clerk? No? Okay.
Good.
City clerk's report.
Back to me again. We are continuing to work towards modifying, updating our invoice structure for our utility bills. Hopefully citizens were able to see a change there. Was on the phone again today with Cassell to make some other adjustments, trying to make it clear what the previous bill was, what payments were applied on their utility statement, current charges, if there are any outstanding amounts, adjustments, or contracts, that also will show up on the statement now, and then a current amount due. Hopefully that will be beneficial to everybody. It should clear up any questions that come on invoices. I've been able to get through reconciliations for the general fund through August. I'm working on September right now. And once I keep reporting, seems like the same thing. But once I've been able to get through all the reconciliations and I know that all the money is accounted for in our books, then I'm gonna go back and make adjustments per Dan MacArthur's office request. And I'm working with Stacy on that still to get everything ready for our audit for the last fiscal year. And then after that's done, the goal is to make sure our fund accounting is correctly being booked so that we have funds to look at and make decisions with correct financial data. Other than
I'm sure that'll make some people happy. Any questions for our clerk? Okay. Public Manager's Report, Mr. Perkins.
So in the power department, we had Lincoln County Power District here, and they raised 2 different service lines to people's homes from the pole to the home that hung quite low in the yards. These were requests from the customers, but that's on us to make sure those are out of the way. One of the lines I could actually reach up and touch if I wanted to. Another one was a little bit higher than that, but not much. They also replaced a pole out by the hospital in part of their doings here, and they've been here and given us estimates on a couple of different things. Met with them in the industrial park to look at moving forward to getting power there and how we're gonna go about that. My guys in the power department have read meters this month, and we replaced several meters that for some reason the displays, like we had 5 or 6 go out one month that we had to go out and replace. On the water side, we did the same thing. We got meters read this month and probably replaced, I want to say it was 18 registers, but don't quote me on that from memory, but in that ballpark, around 20 registers that were replaced that have failed. In sewer, we had 2 call-outs this last little while, where one of them was our problem at the Catholic Church Hall, the one on the south side of the road. We had root infiltration into the joint at the main line and their service line, and that's ours to fix it. So we're gonna be getting with the phone company and getting lines marked so we can dig that up and repair it. We did get it broke loose, so the sewer's usable there, but the root intrusion will become a problem again, so we're just going to replace that or repair it. We also had another call out where somebody's sewer was backed up, but that was not ours, that was on the homeowner somewhere. Parks, we've started turning off sprinkler clocks and prepping for winter. Talked to my parks crew and let them know that they're going to be slowing down, so next week will be their last full week at work, and then if we need them as we need them, we'll use them part-time, but they're gonna start slowing down as well. The parks crew and Rick went and helped clean up and get the super park ready to go for the Bike Fest, and I think that went pretty well. So the park was clean and the pool was usable, the pool building was usable for the restrooms and showers for those guys that were there at the Bike Fest. NDF has been here a couple days helping with weeds. My guys have been able to take the equipment out and get some of the areas with equipment as well, so we're gonna continue working on the weed issue that we have. And been working on the industrial park as far as the dirt work there, as we have time to break loose from other things and go spend time there. That's my report. Has anybody got any questions for me?
You had the honor camp here last week?
Yes.
One day, 2 days?
They were here one day last week and one day this week so far.
Okay. You get some good use out of them?
Yeah, I think COVID issues there still is just hard to get them out of the camp and get our schedules aligned, so.
Work and grant and get some.
Yeah.
Yeah, as far as on a certain day or something, okay, and then.
Any other, Tommy?
Yeah. Down at the end of your tree line.
As you rubbed your elbow across the microphone, I can't hear you.
Down at the end of your tree line down here,
Yes, sir.
along the highway,
Mhm.
right at the end, inside on railroad property, there's quite a big mud puddle in there.
Okay.
I don't know if something's draining in there or if there's a big leak.
So when did you see that?
I seen it about a week ago when
Okay, I'll check, but I know we did have a leak in one of the planter boxes that may have been draining back down that way that got fixed Tuesday this week, I believe.
okay, you probably fixed it then.
But I'll check and make sure that was it.
And you mentioned the,
Questions? Oh.
you mentioned the park guys, last week, full week next week, and then kind of hit and miss.
Yeah, as we start slowing down, things might heat up and we might turn the sprinklers back on, I don't know.
Yeah, well, I've had some citizens ask about if they're gonna still be on for, like, when all the leaves come down, in the parks and whatnot, if we can have that assistance, because that really would help if,
I've talked with them about that, and yes, they're willing to do that. As things slow down, I'm just letting them know that they're not gonna be on a regular schedule
yeah.
after next week.
yeah, they do a good job.
Okay. Legal issues. Mr. Katsky,
Got nothing to report tonight.
any questions?
That,
Director's report.
I had a question for this young man. Where are we at with, I know we've talked about it a couple meetings ago, and I was gonna talk to you before, but the city properties that we own that we wanted to get appraised and put up for,
yeah, I'm still looking for another commercial appraiser that'll appraise commercial property. in
have to have
Lincoln County.
two, is what you said, right?
Yep, in order to pass a resolution. So people rarely call back is the problem.
I know Corey Lytle had this problem, and I think they got away with doing one, but they had to write up an explanation of why. I don't know if you can talk to Corey
Check the
about that.
statute again, but the statute says you have to have two for a resolution. So
Gotcha. You know what? And the one I want to say is different. They were trading property, not selling, so that might be the difference.
Okay, no further questions, Mayor, sorry.
The building inspector's report.
Okay, before I get into my report, I do have some information that I just received at a planning commission meeting about that property. I think that we're on the verge of getting an appraiser that was willing to come over here and do it.
Which property
I
is
didn't
this,
have a
Ken?
chance to follow up on it today.
Which property are you talking about, Ken?
Primarily, they were interested in the old rodeo grounds, doing some issues with it in the way of apartments or I shouldn't say apartments, but they want to do condominium style over there.
if you have someone that's interested in doing commercial appraisals here, give me their name because we have to pass a resolution
Yeah,
first.
no, but as soon as I can get a handle on this guy and get a chance to talk to him, then we'll have some information on it. We have a local realtor that is very interested in that. Obviously, they want to sell the property, but they have the connection that we may be able to solve that problem.
It's good news, and we need that resolution, but there's also other properties.
Yeah.
The other ones that were on the list, yeah.
And I agree, we should do it all at once, not just pick a property. We should get it lined out for all the city-owned properties and get them all done at once. Now, it's probably gonna cost us some money. I mean, everything else does, but we all know that.
Yeah.
But if we can get it down to a reasonable amount, then we can build it back into the sale of the property. Okay, the only other thing I've got is the apartment buildings. We finally have an answer out of FEMA. Let me rephrase that. We have a partial answer out of FEMA. FEMA has basically approved our letter of map amendment for the apartments to take it out of the floodway, which will turn the wheels in the government for us to, for the new owner to get the money to buy the property through using federal funds from HUD. We should have an answer on that. Well, they said this week, but you know how that goes too. So far, I have not heard. but if we have it by the end of next week, the Nevada Rural Housing has given us a verbal extension on the time period they had. They wanted everything done by the end of September. Well, we didn't obviously make that, but we're on the verge of getting it done. So by our next meeting, we should have an answer from Nevada Rural Housing, who direct the HUD money to wherever they can. So it's looking a lot more favorable than I thought it ever would, let's put it that way. With any luck, we'll be working on it before the year's out.
Okay.
And that's, I mean, other than the Shady Motel Administration Building is the lights at the end of the tunnel there. They're working on finishing it up now. And that's all I have right now, unless somebody's got any questions.
Yes.
Are you talking about a new HUD project, or are you talking
No.
about a project?
There, the audit departments.
Okay, thank you. I didn't understand.
But what about the property?
Question, you gotta come to the mic.
What about the property that you're talking about, the rodeo grounds? Is that gonna be another
No,
low-income
we're,
housing?
we're to discuss, and all we want to do is find out how we can sell it. There's,
For housing.
that's something we were looking at housing project is what I was looking at. First I'd ever heard of this, so I don't know.
Well, we've all seen what the low-income housing has done for this, the little city. So I have another question, if I may, unless you want me to hold for public comment.
Why don't you hold to public comment, please? Okay, any questions for our building inspector?
Let me address that issue she just brought up about these condominium apartments will not be low-cost housing. I mean, they're gonna be whatever the going rate is for new houses at this point in time in the city. Right now, I'd say that probably the average price for existing buildings right now in the city is in the neighborhood of 175,000 to 225, depending on the house. So these will probably be in the same ballpark. They will not be low cost or subsidized housing. I mean, these people are gonna buy that land and make money with.
Yeah. Okay. Discussion of related issues, public safety. Fire chief. No sheriff's office, they left apparently.
With his tail between his legs.
Discussion of council members' responsibilities, beautification committee, Mr. Fitzsimons.
Well, our next meeting is going to be October 19th, third Tuesday of the month. Happy to report, beautification ladies working hard. I don't know if you've seen Uptown and the Scarecrows. They like to do that island and the seasonal stuff. We realized they were going to turn off the water, so they're not really mowing that strip of grass. They wanted to put them on the light poles. Initially, these ladies got together last Sunday with their scarecrows and set them out there on the island. They've encouraged local businesses to do the same. Some have, some private citizens have as well. The elementary got involved with their 4 house systems and put 4 scarecrows together. So other than that, Mayor, that's all I have. Be aware of more scarecrows appearing. I want that on the record. I'm good.
Be there.
Any questions for Sean? Okay, community development planning, Mr. Rao.
All right, we had our planning meeting last night. Those people would like to know the status of all the lights that have been repaired and which ones need to be done and where the city crew is at, or the power district on having them all done.
So that list that I gave you, or I'm sorry, that list you gave me.
There we
yes.
go.
All of them on that list have been checked off. They've replaced bulbs or photocells in all of those except for the two in Dixon Park.
Dixon,
I'm sorry, Rose Park. I apologize. Rose Park.
and that's in the middle?
Yes, the two in the middle because they don't want to take their trucks on there until that has a time to dry out a little bit.
Okay.
So lights should be done. If we're still having problems, there could be other issues with that list you gave me, and we need to address those. So if somebody's seen anything else, feel free to call me, email me, grab me, and we'll start another list.
Okay, another thing that they requested from you was, do you know the cost of these dog bag stations that surround on the main street?
Not off the top of my head right now, no.
Okay, can you get that figure to us? And
Yes.
and they would like a couple more installed, especially right across from the Naughty and right across from Jerry's.
Okay.
And well, I think there is one across from the Family Dollar where people stop and to eat or get gas and they take their dogs over there. They need them right there so they don't have to walk down a half a block to do them. And they also wanted some in the super park over there.
Okay, so.
And there is already some at Dixon Park, isn't there?
I don't know. I don't think there is.
If there isn't, we need to, when we find out what the cost is and if we can afford them on our budget, we need to get enough to supply the town. And if I can get that information to them at our next planning commission meeting, they'd just be happy as hell. All right. The Lincoln County Regional Development will be meeting here at the depot on October 18th at 4:30. And Steve, the Regional Transportation Committee will be meeting on a Zoom meeting October 21st at 11 a.m. You got that information then? No? 11 a.m. on October 21st. And the Lincoln County Regional Development that is working in regards to putting a state 4-H camp in Lincoln County. We'll have more information at that on our Lincoln County Regional Development meeting. And I'm thinking that the BLM land inside of Pioche is going to be one that's going to be very acceptable for them. So that'll sure help the county. Okay, that's all I have.
Any questions for Tommy? Okay, tourism, Boxcar Museum, Mr. Laverie.
I've got one question for Tom. What about the one on top of the summit? It's not open enough for that?
They wanted utilities if they could get them, a place with utilities.
So I will follow up with Susan and, the room tax board, Sean, Mary, and them on the decision tonight too, and let them know kind of, I guess, where I was coming from. And then I think the money going towards the boxcar for the deck is a big bonus for the Boxcar Museum. And then the only other thing I have is, Bike Fest. That seemed to be a success, and they were talking, kind of just coming off COVID, they figure next year it'll be back to bigger and better, but I mean, they had quite a few people here and utilizing the trails, and a lot of them go up to Barnes Canyon and use that, but, Christine didn't make it, but speaking with the other people out there, they figured next year would be even bigger. They did bring quite a few people in.
All you got? That's it. Any questions for Joe? Okay. Public utilities, Mr. Hunter.
Not much to report. We've had pretty easy going, no real major complaints on the utility side, so everything's been going good, and the guys are doing their jobs.
Okay. Any questions for Mr. Hunter? All right. Oh, on September 24th, I had a League of Cities meeting, Zoom meeting on the phone or on the computer. They have that once a month, or whatever it is. Mayors and chairs, so. Anyway, there wasn't too much to do with us on that. They were mostly talking about the COVID stuff and penalties and things going on, and mostly in Vegas. On the 28th, well, we had that meeting in here on the 28th on this deal, and there was between 50 and 60 people here on that deal. It was pretty well attended, like our meeting tonight. October 1st, we had a meeting with Carmen Polly, the architect on the depot here, and they're got the final stuff going on. We're gonna get that stuff in right away, and so we can get that out to bid. So that's coming quick. The Bike Fest out here, add on to some of Joe's stuff there. I went out to that. Wasn't as many vendors as there normally has been, but they did have vendors out there. Last time we had it, which was 2 years ago, they had 152 people participate. I think this time we had between 50 and 60. I didn't get exact number on that. But I know about 2 weeks before they had like 52 people had signed up. Whether or not how many actually came in and did it, I'm not sure. But they were shuttling people back and forth, and everything seemed to be going pretty smooth. People were pretty pleased with what was happening, so. And lights, we're talking about lights. The lights in the parking lot there next to your shop don't work.
Okay.
And the next two lights going down the back alley don't work. So that whole area there's a couple of those lights will come on and off.
Yeah.
But
I noticed.
some of them are completely off, not on at all. There's at least 4 or 5 lights right there that's out, that one section. And the office over here has been working. Craig, he's been working, I see him in here still late at night. But he's catching up with this stuff, and I think that we're gonna be way ahead. And I don't have anything else. Anybody have any questions for me?
No, but you mentioned our city foreman and asked him a question. What's the situation on our industrial park? How much more work has got to be done out there?
So with the agreement to rough level the area for him, so there wasn't a big hole in the middle, we probably 4 days, 3.5, 4 days of work, but we just have a hard time getting out there and putting in a full day. You know what I mean? So I would hope not the end of next week, but the following week we should be done and be out of his way if that's what you're asking.
You got about 4 more days' work?
Yeah.
Full days?
Yeah.
But it's gonna take 2 weeks to.
2 weeks to
get
get those 4 days in, probably.
Okay, and at the end of that, you'll have a cost of what it costs the city to prepare that?
Yes.
Pretty much? Okay.
Yes.
Great.
Yeah, we've been tracking it. Craig was able to put in a new line on the timesheet so they could track their time that way. We're tracking all the fuel, wear and tear on the equipment we don't necessarily have, but we can track the hours.
Okay, one more thing on my report. The planning commission last night questioned this cars parked on city property over by the trailhead, edge of MacArthur Drive and the shop. The cars parked there. Some of them's been there for years with all the tires flat. And anyway, they questioned that. How come the city's letting them do that, et cetera? And I told them that they've been there longer than I've been in here this time. And whether the city gave them permission to park there, I didn't know. But the one that's parked up here occasionally, that motorhome, the city gave them permission to park there. It keeps it off the street and it's out of the way, and it's never in anybody's way there. So, anyway, they were wondering about the cars.
Okay, I didn't put one deal on here. State Treasurer is holding a listening session in Caliente on October 13th. It's, county residents are invited to attend a listening session with the Nevada State Treasurer on October 13th at 10 o'clock in the morning. The event is part of the Nevada Recovery's Listening Tour and is being hosted by the Lincoln County Regional Development Authority. And the tour is seeking input from Nevadans throughout the state for properties and ideas on how to best to allocate the state's share in federal American Rescue Plan funds. And those wish to attend should RSVP by Tuesday, October 12th, and by emailing. And that's in the paper, so if anybody's interested in that, they probably ought to.
Did you say 10 or 10:30?
10 o'clock.
Okay, I got 10:30 written down.
10 o'clock. Yeah, I don't have anything else. Anybody have any questions for me? Okay, public comment. Do we have any public comment related to the matters of the city? In consider with others that may also wish to provide public comment, please avoid repetition and limit your comments to no more than 3 minutes. Public comment.
Something Kid said kind of caught my attention. So when we're talking about the Caliente Apartments, so you said that they have petitioned FEMA to relieve them of the flood taxes that everybody has to pay?
No, I didn't say that.
This is public comment.
Well, I'm trying to find out if,
Okay.
what did that mean?
Okay, you can talk to us after the meeting.
Okay.
We'll talk to you about that.
Susan Deveroy, I think you guys are doing great, and we have some wonderful people moving into town, and a lot of property owners are fixing things up. It's doing great. I think property values are gonna go up.
Susan, did you sign in today?
Yes. And my light in the alley.
Good comment.
Is that doable? The one that goes on and off in the alley? The light in my alley?
In your alley,
please.
right over here, okay.
Okay, thank you. Thank you.
All right.
Comment, Tommy?
Yeah, like I mentioned before, we usually don't get a big crowd here, but when we get something on the agenda that draws the people attention, we appreciate you coming so that the people that were here presenting this can see what the community feels. And we thank you for coming and appreciate you being here. Thank you.
I like the doggy bag idea. That was good on that doggy bag.
Just on the, I know this thing's gonna go behind me and I'm gonna fall, and I'll own the city. No, not really. But anyway, on the Bike Fest, they had over 80 people show up, plus about 20 to 25 volunteers that went out and cleaned up Mount Deli. They had the 3 restaurants, the Silver came down, Mary Love's Place, and the Naughty, and I'm telling you, the food went fast. They went through over 100 plates. And with the doggy thing, why the woman from LCAT was asking me is, when they went to, God, you think I was a smoker. When they went to set up the tables, they actually picked up 20 little dog baggies of dog feces. Seriously, I was there.
Where at?
The grassy thing.
You're saying they took bags and went and picked that much stuff up?
Yeah, there was
Gotcha.
20 little piles, and like I told her, it's not from people who walk their dog, because they usually pick up, is the 4 o'clock dogs that go out and leave the calling cards, and the 5 o'clock in the evening dogs. But that was the main reason they wanted that, and it was a really big, I mean, it was really good. It was a lot of fun for people. So thank the city crew for what they did, because it was really nice.
We have any other public comment? Okay, need to schedule our next meeting.
October 21st.
Okay, if we have anything that needs to be put on the agenda for that.
Yeah, what'd we say, the 21st? Okay, and then, yeah. I don't know if that's an agenda, though.
Well, I think they're talking about the room tax approved something that needed to be on the agenda that wasn't.
Oh.
I have that request now.
Yeah, okay.
It'll
I
be
don't think
there.
that's an agenda, but yeah, we have it. Okay.
Okay, nothing else has to be on there? Adjourn this meeting. Yes, ma'am. Sorry.
So I couldn't understand, so are the apartments is FEMA taking exception and not?
No. What happened was when they built this thing, the flood zone was at a certain level,